All right, peace be to you all. Assalamualaikum, Omar here. So I promised myself that I would try to do videos at least once every other day. So I would also make those videos relevant to what was going on in the news and how that related to healthcare, since I'm a clinician. For those of you who don't know, I am a licensed physician assistant in Washington, D.C. I also work in Maryland. I'm also a health educator. So what's in the news? What's going on? Lots of stuff. Probably the most prominent thing is erstwhile President Donald Trump. He has been charged with 34 felonies from what I saw in the news. That's not something I particularly celebrate. I look at things as a clinician before I kind of take sides, and then I try to, examine things, by looking at different news outlets, who's saying what about the situation, and then come to a conclusion. And that conclusion may include a few different conclusions. So I do this as part of my clinical way of thinking. So a patient comes to me with different signs and symptoms, and I form what's called a differential diagnosis based upon those various signs and symptoms and the subjective data that they give. So if they say they've got a stomach pain, how long has that pain been going on? Where is it located? How have you tried to treat it? So with this situation with Donald Trump, I would say, well, exactly what has he been charged with out of these 34 supposed felony convictions or charges? How many of them are actually going to stick? What's going to come of this? And then he'll if certain other parties have their way, I guess the Democrats and maybe some Republicans, he will not be able to run for president this term for 2024. But he has a lot of supporters. Now, my biggest concern outside of that is what's best for the health of American citizens. What's the best type of healthcare plans we can get? How can Americans lead healthier lives? That's who I take care of. I'm American. I'm here in the U.S. I love humanity, but I gotta take care of the people that are in front of me first. I think that makes sense. So whether he is unable to run and they put some other person on the ticket, I'm assuming it's going to be, I forgot his name. The guy from Florida. I'm having a mental block right now. Maybe that's a good thing. But whether it's him and Biden, or possibly, him versus Kamala Harris on the ticket for going against each other in 2024, I still ask myself, what party would be best in terms of the implementation of things that could help people with their health? I've always worked with folks who are financially struggling, so they're on the lower socioeconomic strata. They have little to no insurance, and the folks I work with now are of the aged population. I'm approaching that. I'm in my mid-50s, so 60's coming real soon, Lord willing, if I'm still alive. So what are we going to do about this gray wave? You're going to have, typically people have got age-related illnesses. With that comes polymorbidities, what we call in medicine, and with that comes polypharmacy. That's a lot of medications. Is Medicaid and Medicare going to cover for all those medications? Will people be able to even afford private insurance? Not the way not the way the economy's going now. And I think we're in for a lot of hardship, in terms of how healthcare is managed, and a lot of that has to do with who's in charge, whether it's the Democrats or the Republicans. I think the Democrats tried with Obamacare, but it didn't work for everybody. That's the fact of the matter. And we'll see what whoever else is in charge in 2024, whether it's Trump, that might be a interesting thing to actually see him win in 2024. Stranger things have happened, but we'll see. I'm curious to know what you guys' thoughts are on this Trump situation. Please be polite to me and polite to each other. I'd also ask you how you think policy affects healthcare, and if it's affected you personally. All right, that's it for now. If you have an interest in becoming a physician assistant like me, or a health educator, I do free mentoring. You can follow me around if you are in the DC or Maryland area, and you can follow me in the offices where I work, and maybe get a letter of recommendation out of it. You can get shadowing hours as well. And if not, tell your friends about it, your friends or family who would be interested in being a physician assistant. It's been a great career. I've been doing it for more than 20 years. I would have left it by now if I didn't enjoy it. All right, that's it for now, guys. I wish you guys the best of success in your positive endeavors. Peace.